We already talked about it. It could be anything we talked about in the context of kids, but it can happen in other relationship, husband and wife, if there's a domestic violence, there's a trauma like a natural calamity, like we had floods right now. If somebody saw their kids dying in front of them, that's a big trauma for them. They won't be able to deal with it. And unless they get proper treatment, which unfortunately is not available everywhere, they may end up using drugs and become addicted because they don't want to, because when they are not using drugs, then that thought haunts them and they can't deal with it. It's so bad emotionally. So it's better to numb yourself. So that becomes one of the reasons. Socially, isolation, people who do not have relationships, they have so low self-confidence, they can get depressed, anxious, they may pick up drugs. Poverty, another reason. If you cannot bring bread to the table, you cannot feed your kids, your loved one has a disease, say cancer. They always say, doesn't matter how rich you are one cancer away from poverty. So it's a very expensive treatment. You cannot provide it, but you can't see your loved one suffering. What do? You need to disconnect yourself from that painful misery. You go and use drugs. Interpersonal conflicts, can deal with your siblings, cannot deal with your parents, cannot deal with your spouse, may end up using drugs. So Kanzian's is one of the doctors who came up with self-medication hypothesis, which is the thing I described with untreated mental illness. People sometimes use drugs to treat untreated diseases. So like ADHD is a very common example. Someone who is a teenager is struggling in the college, not getting good grades, but knows that they are good. They're good in certain areas and they may be really good in those areas, but they can't sit down and finish a book or do a research paper or concentrate. When they cannot do it, somebody gives them a drug. Hey, why don't you use it? I had used it. They start using, they like it. Self-medication. And it's true for other drugs of abuse too. Natural versus drug reward. Why do people go towards drugs versus, say, natural rewards? So all of us need dopamine to feel good, to get motivated, to do work in our daily life. If there's no dopamine, you won't be able to get out of the bed and do anything. So we all need it. It's a natural compound and we need it. So the most common thing is your family. When you see, like, suppose you have your siblings that you've not seen for 2-3 years, your kids who are studying in some other town and the parents are in a different town, they come and visit you. There's a different rush of dopamine and oxytocin in our brain. That is the natural reward system and we feel great. Similarly with food, if there's a particular food that you like and you go to those places, you would know people who travel many hours to go and get good food because that's how they get their natural reward. So the amount of dopamine that you get from natural rewards is on the left side, which is about 150% of the basal dopamine output. So we've all got the basal dopamine. And if there's a good reward, like seeing your family, you're participating in good sports, any activity that you like natural activity, music releases a lot of dopamine in the brain, food. So you have up to magnitude of 150. But on the right side, if you look at drugs, and one example is amphetamine, that increases the dopamine to 1,000 to 1,100% of the basal rate of dopamine. So how do you match that up? The normal rewards are only giving it to 100%, and the drugs are taking it up to 500, 600 to 1,000%. So that is a really powerful reinforcing supraphysiologic response. So when the supraphysiologic response happens in the brain, then brain tells you this is what you need to do. The most important thing in your life becomes using drug because you have never felt this good in life. And this is all happening in the brain. So this is the reason why people start using drugs. You may have heard the term hijacking of the brain by drugs, but this is exactly what's happening. This is the hijacking because they're giving you the pleasure at the magnitude that you cannot get from any other normal reward mechanism. This is the hijacking of the brain. How do you recognize addiction? If someone is struggling, if you are struggling or your loved one is struggling, and or you're seeing a patient who comes in and struggling with the addiction, there are certain signs. How do you pick up on it? Their sleep will change. Either they will sleep more or they'll sleep less. Their appetite will change all of a sudden. Like somebody who is fine throughout all these years, all of a sudden for last 2 months, they are not themselves. You need to inquire, you need to figure out what's going on. It could be drugs, it could be some other emotional issue, mental illness they're struggling with, but you need to look at it. If their appetite changes, they're eating more, they're eating less, losing a lot of weight, gaining a lot of weight. Mood swings, they were pretty normal, chill people. Now all of a sudden they're irritable, they're losing it, they're short. You need to then inquire. Irritability, they're more, again, more short at home, throwing things, being withdrawn, isolated. They just come home and lock themselves in the house because they're using drugs. Suspicious behavior, they feel like somebody's after them. A lot of time these people will go into their room, turn off the lights and cover the windows because they feel like somebody's watching them, because the drugs will make them paranoid. Like stimulants, cocaine, methamphetamine, they make you, marijuana, they make you feel like somebody is after you, watching you, monitoring you. Out of character behavior, they're talking very fast. Normally, like what you are paying attention to is somebody who has got a baseline, and now there's an out of character behavior. It could be in sleep, appetite, or in talking, spending money. They start working on multiple projects. They're not sleeping till 3 a.m. And if you talk to them, they say, yeah, I've got these 4 projects I'm working on. Doesn't make sense. What is going on? Either they're using drugs. Is there mania going on? Is there something else going on? You need to recognize there may be something going on. Coming home late, spending more time outside, because now if they're outside with friends and they're using drugs, after intoxication, they need certain hours to recover. They can't just use and come home, because then they will be intoxicated. So they're spending more time to recover and come home. Track marks, if they're using IV drugs, you would see the lines where they shot the drug. So those are the track marks. Drug paraphernalia, if you find needles in their room, if you find foils, if they are drug residue powder or the empty bottles of alcohol, that means they're using drugs or engaged in that behavior. Alter physical appearance and personal hygiene. So somebody who's using drugs is really not paying attention to themselves, because that's not the goal of life now. The goal of life is to get up and use drug and get the drug somehow and get high, because that's all your brain thinks right now. So you're not paying attention to anything, your nails, your how do you look, whether you take shower or not, whether you are taking care of your wounds, that if you have any wound on your body, they don't take care of anything. Decline in academic or work performance. So for students, it's important. Their grades will start going down. So parents should pay attention to what is going on, why they are not able to keep the grades. Shaky hands, bloodshot eyes. In marijuana use and cannabis, most common is bloodshot eyes. So you would see their eyes are red. If they're shaking, that's the sign of tremor and withdrawal. For alcohol, it's very common, and for benzos, it's very common. Physically, it can also harm you. So those are some of the things we said, that you could, some of the signs you could look at. But also, if they're using drug, they can run into accidents. If they're intoxicated, their judgment is impaired. So suppose if you're driving a car and you're intoxicated, you may not know how far you are from the car. You may apply a brake sooner, or you may not apply the brake at all. So there's a risk of running into that. There are assaults, all sorts of assaults can happen, homicide, sexual assaults, violent acts. Very hard to sleep, think, reason, remember, do the problem solving, because now the executive part of the brain is gone, because you've used so much drug that you have put that brain to sleep. It's all the animal brain now. So you can't reason, you can't think. Multi-organ damage, as I said, take example of alcohol. It can cause cancer of almost any part of the body. It can damage the heart. It can damage the liver. It can damage the brain. Cancer issues, infectious diseases with IV drugs, especially if someone is pregnant and they use drugs, they can harm their babies. Skin lesions, because they're shooting drugs or they're scratching. Sometimes people, when they are coming off of drug, they feel like there are bugs crawling on their skin, so they will scratch their skin and cause lesions on their skin. Jaw issues, teeth most common in the meth use. It damages the enamel of the teeth. Mood swings can happen with any drug. Psychosis can happen. And then accidental overdose. If they take too much of a drug, they may even die. Like opioids is very common. They can suppress the breathing. Benzos is very common. So if they take too much of it, they can accidentally die. Or if someone is depressed and they have a drug at their hand, they can use it as a means to end their life, suicide. can also happen. Can people recover? So suppose now, for now, up till now, we talked about the signs and how the addiction develops. If someone who has developed addiction comes to you for help and they ask, hey doc, uh, can I recover? So this study is very good. It was done in methamphetamine users. If you look at the left side, healthy brain, you see these red and orange patches, which means there's activity in the brain. That's normal brain. When they use drugs, and in this case, methamphetamine, this activity slows down. So the brain is not working now. So if you look at 1 month abstinence, this is you see a very small dot, but not compared to this. So, but after 14 months, the brain start looking like the first one. So after 14 months, they may actually recover. So there's hope. If people get treatment in time and they stay away from drugs, the brain can recover. So adolescent brain and addiction, I think for students, I added this slide. It's important. I want to touch upon it. What are the issues if you're a student and you get into addiction of the drugs? Is it different for young people versus older people? So one problem is if you become addicted early on, you got more years of life in addiction. So definitely it's going to affect your brain. And as opposed to somebody, so somebody gets addicted in their like 17-year-old versus like 47-year-old, of course, you got more years of injury to the brain if you keep using it. The other thing is the cycle of addiction. Once, if you look at someone who is addicted, they get up in the morning and the first thing is they're withdrawing from drugs. And very common example, you may have seen it in the society, is the cigarette smoking, because cigarette is very common. A lot of people smoke cigarette. The first thing they want is a cigarette. They don't want anything when they get up. They don't even brush their teeth. They want the cigarette. And you may have seen it a lot in the society. Same happens with other drugs too, because you are withdrawing, you have a need, your body is telling you, brain is telling you, give me the drug I want. And since your upper brain, the higher brain is not functioning, that cannot tell you that it's bad for your body, is the animal brain. So it wants what it wants. It's like a lion. If it's hungry, you need to feed it. And they start feeding the addiction. So the first thing in the morning, I need to get drug. How do you get drug? You need to have money for it. If you are a student, you're not going to have a lot of money. What are you going to do? You use your pocket money. You go to your friends, you ask them for money. You go to your family, you ask them for money. And after a while, people know that this person is wasting money. Nobody's going to give you money. And there's a term that we use in addiction. It's called burning your bridges. But this is exactly what you're doing. You're burning your bridges. You are going to the people who trust you and they're your friends. But one by one, you are burning those bridges and you're not going to have anyone by your side when you need them. So somehow you get the money. And if everybody says no, you're going to go and steal money. And unfortunately, what happens in our community now, not just stealing, people commit crime to get money, to get drug, because the main salience in your brain, the most important thing right now for you, the purpose of life is to get that drug and feed your brain. And you do anything and everything to get that drug. So that can happen. And then once they use it, then it takes about 2-3 hours because they are high. So they can't really concentrate or talk to anyone. They will be just like enjoying the high of the drug for 2-3 hours. And then when they get out of that high, they start withdrawing and that cycle goes on. So if you are going through all that, how are you going to study? How are you going to concentrate in the class? You're sitting in the class, but nothing is getting registered. So you lose that knowledge, the time that you were supposed to acquire the knowledge, you're not acquiring the knowledge. So then you will have problems in your goals. Suppose you want to become a doctor, you want to become an engineer, you want to become software engineer, you cannot do all that, IT expert. You can't achieve those goals because you were not present in the class and you could not even go to the class. You will have absenteeism. So all this will happen because of that. The other important reason is our brain, especially the prefrontal cortex, that is the executive area and the higher level brain, that keeps developing till we are in our 20s, like 22, 23. So you are also hampering that process. The brain will not develop normally. You will, the myelination, which is basically the sheath on the neurons, that will get affected. So your connections are not developed. The brain is not developed, the brain is immature, and the most important part that we need to make decision and reason, that is not developed. So all these factors are important in the adolescent brain. The other thing, why young people use more drugs than others, because they are more impulsive. This is part of growing up. You are vulnerable, you're impulsive, you take chances, you that's how you acquire skills. But if you take your chances in the wrong direction, you may end up using drugs and then may never be able to really achieve your goals. This is a slide talks about the stigma, which is important in the society for all of you. What can you do as a student? What can all of us do to help the disease of addiction, to reduce the burden in our society? One thing we can do is to understand that it is a chronic brain disorder, just like diabetes, just like hypertension, just like any other disease. We need to treat it like a brain disorder. And so take that example. Suppose someone who is diabetic, their blood sugars are high, the pancreas is not producing insulin. You put them on insulin and they are doing fine as long as they follow the treatment plan. But sometimes they will go out, say in a wedding, and they eat outside and they eat too much and their blood sugar goes out of whack. They come up to the in the hospital. You again help them, stabilize them, send them out. This happens a lot of time in someone's cycle. Either they become hypoglycemic or hyperglycemic, and doctors help them out, or over time the requirement of insulin changes and we need to titrate it up. Similarly, addiction is a relapsing and remitting disorder. It's not like you would go and get the treatment once and you're going to be cured. They will struggle. It's a lifelong chronic brain disorder. So they have to know they need to be in treatment. And if they have a relapse and they have, suppose they had somebody who died in their family and they were feeling very low, that's a chance that they can relapse. Or they met an old friend who they used to use drugs with and they end up using again. So what do? Again, just like diabetic patient, if they come in with hyperglycemia or someone comes in back with drug use, you try to help them again and give them relapse prevention techniques and tell them this is a chronic disease, this may happen, but you are on the path of recovery and this is what you need to do, get back on the um, recovery wagon and then and get back in treatment. So stigma is influenced by whether you think someone is to blame and whether they have control over the behavior. The problem we have right now throughout the world, more in our country, less in the Western countries, lesser, but still we got a huge problem here too, is that people still believe it's a moral illness. And that's how it was introduced in the past. It's a moral illness. It's a characterological flaw. If you use drugs, you don't have a strong will, you have something wrong in you, that's why you go pick up the drug and you use it and you can control it. But when you go with that approach, then you are neglecting the chronic brain disease model. Why don't we do the same thing with diabetic? Why don't we say you don't need insulin, it's a moral illness, you should be able to just control your diet and you'll be fine? Or hypertension for that matter. Similarly, for addiction, we need to consider it as a disease model. And yes, there is a moral sort of phenomena which with any disease will work. So for diabetic, they need to have a strong character, not to eat sweets all the time. They need to follow their diet. They need to do exercise. Similarly, for addiction, they need to not hang out with people who use drugs and not pick up drugs, but they also need treatment. And we need to understand it's a chronic brain disease. So when does the stigma decrease? When it's not their fault, when they cannot help, when you tell them and when you understand it's a disease, they can't help it, they need help from us, then stigma will go down and people will come and bring their loved ones and their family members to the treatment. One good example for that would be even in your university, if I send out a survey today and ask everyone, how many of you have addiction disorder versus how many of you have any medical problem, I'm sure I'll get more responses on the medical problem. People would be fine to talk about they have hypertension, they have diabetes, they have some other issue that they're dealing with, but they won't be comfortable talking about they struggle with opioid use or alcohol use. And this is only because of a stigma, because it's not looked upon nice in our community. But if you look at research, it's exactly the same, just like diabetes. There are brain changes, which I showed you the scans for. So these are the changes that are not in control of someone. It is happening in the brain. We need to treat it as a brain disorder. Historically, there were some treatment approaches that were tried for addiction, like psychoanalysis, which is basically what we do is we bring down the defenses or the upper part of the brain executive. We kind of put it to sleep for a while and have the lower brain come out so we can resolve the conflicts. But that works against addiction, because in addiction, exactly that's what happens. Your upper brain is not active and the lower brain is active. So this approach did not work. They tried confrontation and boot camp, like telling people it's not good, do not use it. That doesn't work. Or chain them and hoping that they'll get better miraculously. That doesn't help. So the newer approach is we got some medications that are helpful. Counseling means there's the technique that we use is called motivational interviewing. In that, you involve people in a collaborative setup where you ask them what are the things you're struggling with and how I can help you, and make a good bond with them, be empathic, feel like they are going through this issue which is out of their control. And if you go from the lens of the disease model, you should be able to build good rapport. Once you have a rapport, people will talk to you and tell you, hey, this is where I struggle, I need help with it. They may say, I have terrible anxiety, there's nothing that worked for it, drugs work for him, can you help me? Of course you can give them some anti-anxiety medication. They don't need to use drugs, or depression or pain for that matter, and then you may be able to help them. And there are some psychotherapeutic other techniques, mutual help groups. That is the recent approach to treatment. Goals of the treatment: you want them to be able to reduce or eliminate their drug use. You want to address their physical or mental health problems, and then you want to restore their maximum functional capacity. The end goal for any disorder when we are treating it is that we want them to be functional, to contribute to the society, to go about their life, to help themselves, to help their families. That's how you form a good society. That is the end goal for any treatment. These are some of the drugs. We'll just briefly touch upon that. For opioids, we have 3 treatments that are approved. One is buprenorphine, the other is methadone, the third is naltrexone. Unfortunately, none of those is available in private hospitals in Pakistan. I have heard in public hospitals. Privately, I've heard there's some people who are able to acquire it, but it should be available openly so we can treat this population. But unfortunately, at this point, it's not available. Stimulants, there's no approved medication, but there are some studies. There are medications used, like bupropion and naltrexone study that was published in NEJM journal last year. That is a very good combination that can be tried. For alcohol, again, we have 3 medications. We have disulfiram, we have naltrexone, and we have acamprosate. Those are approved, and I'm not sure, I don't think so they are available in Pakistan in the public hospitals. Nicotine, we have substitution therapy. So there are patches you can use. Then there are nicotine gums and nicotine lozenges that can help with cravings. And then if they need medication, then there is bupropion and there's varenicline. So these medications are available that can be used. Cannabis, marijuana, no medication available. Mostly it's a therapy that we use, and we use therapy for all these others ones too. It's a combination of medication plus therapy. So contingency treatment, which means that you are rewarded for good behavior. So suppose there's a patient who comes in and they have not used any drugs for last, say, 3 or 4 months, and you did urine, you didn't find anything, you may reward them with something that they like. So if they like to go to movies, you may give them a movie ticket. If they like to some sort of fast food, you can give them a money voucher to go get a burger or something, like small rewards. And there is motivation interviewing that I spoke about earlier, the collaborative approach, and there's CBT, cognitive behavioral therapy. There are other approaches too that can help with the alcohol problems. What are the barriers in Pakistan? This is an older survey done in 2013, but I think if you do it right now, it will hold true. People cannot pay for treatment. It's still true for a lot of people, can't pay for treatment. Didn't have info on local services. A lot of people don't even know where to go. There's a good application, Zindagi app, that you guys should also check out. And if people who are struggling with addiction, they should know. I think this should be, I think it's a government developed it, so they should publicize it more than anything else, so people should know about it. Don't trust government facilities. A lot of people don't trust that they'll get good treatment over there. There are not enough inpatient facilities. there's a fear of registration. Again, that goes back to the stigma. It's a moral illness. People are not gonna look at you nicely if you have addiction, or your kids have addiction, somebody in your family. So people don't want to talk about it, don't want to bring it out. It's true for mental illnesses too. They don't want to talk about it due to stigma. No available beds or slots. Again, if you do a survey in Pakistan, you're not gonna find that there are many people who are trained in addiction, and there are many facilities that can treat people struggling with addiction. Dislike treatment staff. The people may not like how they are treated because, again, goes back to stigma. If you believe it's a moral illness and you go and see a doctor or a staff member, they may say, well, yeah, you're less of a person, you have weak character, that's why you used it, you're a sinner, rather than let's talk about your disease, let's get you better. And then yes, this is a bad thing to do, it's a sin, you shouldn't do it, but approaching it from a medical model will cause more engagement so you can get them better. So what we are trying to do through the collaboration of Apna and our HCF platform is to have everybody who is involved, who can be involved in this cycle at some point. So people who may come in contact with the patients who are struggling with the disease of addiction at some point, having them on one platform so we can provide a community-wide